So we're at South Sacramento Kaiser in South Sacramento, and this is Nurse Vivian Camillo. Okay.
So this is where I work, and I work in the peri clinic, and this area here is our clinic area. We have on this side of the building is all the doctors, psychologists, offices, and then on this side it's patient exam rooms.
Okay.
So here is our procedure area.
Okay.
That's the entrance.
Can we go in?
Yeah. And this is all the patient with our patients. We prep our patients, and also we cover our patients in this area. This is where the nurses sit.
Oh, okay.
And then we have 2 exam rooms right now. We'll probably have a third one in the future, but for now it's 2 exam rooms where we do all our procedures. We have what we call a C-arm too, because we work on the spine, and so you can't see that from the outside, so you need X-ray to guide your placement of your needles.
Oh.
Yes, patients go here. And then the doctor is right here doing the procedure, which is this table. And then me as the nurse, I would monitor the patient's vital signs here.
Oh, so you would be standing over here, then the doctor would be here.
He's sitting in this corner charting, looking at the vital signs, and then getting my medications out of here.
So how many patients do you deal with every day?
On average, I would say 20 to 25 patients.
25 patients?
Yeah.
Oh.
On a really busy day, it could even go up to 30, over 30, but average, I would say probably 20.
20?
Mm-hmm. For 2 procedure rooms, which is not bad if you think it's 10 patients per procedure room, and it's not actually not busy.
So you work hand in hand with physical therapy?
We just refer patients to physical therapy, and then they kind of take over, and then they assess the patient, and then they figure out what kind of exercises will work for the patient. This is their office. Help them out with, and then this is our gym with exercises. Oh, I guess they're doing exercise right now.
Oh, I don't know if I could.
Yeah, so we can't go in there.
Yeah.
And then besides physical, so we have psychologists, physical therapy, then we have the anesthesiologist who sees the patient and helps with their medication management and do procedures for them. So we take care of all of that.
So what do you usually do when you check out a patient, I guess?
Check in a patient for a procedure?
Yeah.
So first I have to go over to our reception area and then pick up the patient, bring the patient back here, have the patient change into one of our gowns, and then, so everything needs to come off except their underwear and socks, put the gown on, and then we have them lay down here. First thing I do is always check their ID band, make sure everything is correct there as far as their first name, last name, date of birth, and medical record number. That's very important. And you also check it against the consent. Every time we do procedures anywhere in the hospital, you always have to get consent. And then we bring the patient into our procedure room and do the doctor does the procedure, and then they come back. We bring them back out here after the procedure, and they stay anywhere from 15 to 20 minutes. We monitor their blood pressure, everything, pulse, oxygen, respiration for another 15-20 minutes, and their pain level. We always chart a pain level with every vital signs. And then after that, if everything is fine, and then we check the site to make sure that there's the puncture site. We usually go either in the neck or the low back and make sure that there's no bleeding from that side, or there's no discharge or any kind of signs of infection. You wouldn't get infection right away. Sometimes it takes 24 hours. But anything abnormal, you just want to check the site. Want to make sure that they have feeling in their legs and that they can stand up on their own before you have them get dressed. And so if everything is fine, then we have them get dressed, and then we give them their discharge instructions, and then they go home.